Well, the one state that has been the model that everyone has looked at in fighting the coronavirus has been Kerala. The mortality rates are very low. The doubling rates are very high. Every 30 days, the cases are doubling there. There's just a trickle of cases or new cases that are coming in. And we have Kerala's Health Minister, KK Shailaja, joining us live this evening, straight from Thiruvananthapuram. Ma'am, thank you so much for being with us. I just wanted to ask you that, while Kerala has seen a lot of success in the past few weeks, I believe that out of 6 COVID positive cases in Kerala today, 5 are people who came from overseas. And the last international flight from, into Kerala was around the 22nd or 23rd of March. So there's been a long gap of about 28, 29 days since when they came back and since when their coronavirus has been detected. How is the gap so long?
Yes, it will happen because the infection of virus is like that. 95% we can find out within the incubation period of 14 days, and there is a possibility to have the incubation period become high, and 20 days or 26 days or up to 27 days. The Lancet paper is saying like that, and we took 28 days of quarantine in high-risk cases in Kerala. That proved correct. These persons who caught this virus or proved positive was under our quarantine in home, strict home quarantine, and our health workers are watching them. And when they developed symptoms, we are sending them to hospital, taking their swabs and testing. At that time, they become positive. That doesn't mean that day they become positive. They may become positive before that. Without any symptoms, the virus may be in them. And now we are testing all the asymptomatic cases also. At first, we have the scarcity of testing materials, reagents and RNA extraction kit, etc. Now we got sufficient kits, and now we are testing the asymptomatic cases also who came from abroad.
In about 95% of the cases, the incubation period is 14 days, but there are 5% of people who may be carrying the virus for much longer before it actually shows up, and that's why you have this gap of nearly a month between people who came back and who are now testing positive. But can I ask you, ma'am, that the Kerala government had announced a lot of relaxations in those areas where there are little or no cases, including the opening up of barber shops and some restaurants and so on. But the Home Ministry today came down and said that, no, you can't do that. These are going beyond the Home Ministry guidelines, and so those have been reversed now. Did you think that you all jumped the gun in some of these relaxations?
No, we are doing according to central government's decision and central government's guidelines. But central government said that each states can discuss about that, and you can discuss the hotspots in your states, and also you can declare the relaxation according to that. But we declared the relaxation according to the central government guidelines. Especially we have 2 districts which have no positive cases now. At that place we have some relaxations, and we have 4 districts now, a very good number of positive cases, and that is going down. The graph is going down, but yet there are some positive cases in Kannur, Kasaragod, Kozhikode and Malappuram districts. There we declared as hotspots and no relaxation of anything in that districts. And we identified the hotspots villages everywhere
right.
throughout the state, and in that hotspots villages also we are very strict. But in the case of barber shop, we didn't relax it very much. But because of the personal hygiene, and some people feel mentally also disturbed because they cannot go to this barber shop and cut their hairs. They feel mentally distressed also.
Ma'am, we all agree.
For that person,
we wish the barber shops were an essential service.
Actions.
We all agree, and I think hopefully if things improve, especially in Kerala, we can all go for a haircut. I wish I could fly there and to get one, but I can't. But ma'am, good luck. Good luck to Kerala, because you guys you're leading the way and fighting the good fight. So we look up to Kerala in fighting this as well. Thank you so much for joining us this evening.